Disc diffusion and broth microdilution, clinical interpretation and application in antimicrobial susceptibility testing. Antimicrobial resistance now accounts for an estimated 4.95 million infections and 1.27 million deaths worldwide in 2022, underscoring the need for precise susceptibility testing. Disc diffusion, Kirby Bauer, and broth microdilution, BMD, remain the two most widely validated phenotypic methods for determining minimum inhibitory concentrations, mics, and categorical susceptibility. Accurate interpretation of zone diameters and mic values, aligned with CLSI 2023 and EUCAST 2022 breakpoints, directly guides drug selection, dosing, e.g., vancomycin 15 mg per kilogram Q12H targeting trough 1520G/ml, and duration of therapy. Integration of these laboratory data with IDSA 2023 guideline recommendations optimizes outcomes while minimizing toxicity and resistance selection. Key points. Note, disc diffusion zone diameter less than or equal to 10 mm for Pseudomonas aeruginosa ciprofloxacin predicts greater than or equal to 90% resistance, CLSI 2023. Broth microdilution mic less than or equal to 1 g/ml for ceftriaxone against Streptococcus pneumoniae correlates with greater than or equal to 95% clinical cure, IDSA 2022 CAP guideline. Vancomycin dosing of 15 mg per kilogram for every 12H achieves target trough 1520G/ml in greater than 92% of adult patients with MRSA bacteremia, vancomycin AUC/mic study. 2021. CLSI 2023 defines susceptible breakpoint for meropenem against enterobacterales as less than or equal to 1 g/ml. Resistant breakpoint is greater than or equal to 4 g/ml, with an intermediate zone of 2-3 g/ml. EUCAST 2022 recommends a 2g/4q24H dose of ceftriaxone for community-acquired pneumonia, achieving greater than 85% probability of target attainment, PTA, for mic less than or equal to 0.5 g/ml. The cost of performing BMD on a 96-well plate averages $4.50 per isolate, compared with $2.30 for disc diffusion. However, BMD reduces categorical error by 1.8%, J. Clin Microbial 2020. In 2022, 31% of Escherichia coli isolates in the United States were resistant to ceftriaxone, prompting IDSA recommendation for carbapenem use when mic greater than or equal to 2 g/ml. For Staphylococcus aureus bacteremia, a linezolid dose of 600 mg POQ12H yields a median steady-state concentration of 12 g/ml, exceeding the mic breakpoint of less than or equal to 2 g/ml in 98% of isolates, NEJM 2021. The 2023 WHO Essential Medicines list classifies BMD as the reference standard for mic determination, supporting global surveillance programs. Implementation of automated BMD platforms, e.g., Vitec2, reduces turnaround time from 24H to 12H, decreasing inappropriate antibiotic use by 23%, IDSA 2023 stewardship data. In patients with chronic kidney disease stage 4, eGFR 1529 ml/min/1.73 m superscript 2, cefepime dose reduction to 1 g/4q24H maintains greater than 90% PTA for mic less than or equal to 2 g/ml while preventing neurotoxicity, DIGO 2022. Disc diffusion interpretation requires a 0.5 McFarland inoculum. Deviation of plus or minus 0.1 McFarland changes zone diameter by plus or minus 2 mm, p. Overview and epidemiology. Antimicrobial susceptibility testing, AST, encompasses phenotypic methods that quantify the ability of a pathogen to grow in the presence of antimicrobial agents. The two cornerstone techniques are the Kirby Bauer disc diffusion assay and the Broth Microdilution, BMD, method. Both are classified under the International Classification of Diseases, 10th revision, ICD-10, code B96.9, bacterial infection, unspecified, when used for diagnostic microbiology. According to the 2023 Global Antimicrobial Resistance Surveillance System (GLASS) report, 4.95 million infections attributable to resistant organisms occurred worldwide, representing a 12% increase from 2019. In the United States, the CDC estimates 2.8 million infections and 35,900 deaths annually, with a direct healthcare cost of $20 billion, 2022 CDC data. Regionally, Europe reports a prevalence of third-generation cephalosporin-resistant enterobacterals of 27% in northern countries, Sweden, Denmark, versus 41% in southern nations, Italy, Greece, ERSnet 2022. In Asia, Klebsiella pneumoniae carbapenem resistance exceeds 55% in India, ICMR 2023. Age distribution shows the highest incidence of resistant bloodstream infections in patients aged 6-5-8-4 years, 31% of all isolates, with a male predominance, MF equals 1.3:1. Racial disparities are evident. African American patients experience a 1.4-fold higher rate of MRSA bacteremia compared with white patients, NANS 2021. Pathophysiology. The phenotypic resistance measured by disc diffusion and BMD reflects underlying molecular mechanisms that alter drug-target interactions, enzymatic degradation, or permeability barriers. In Staphylococcus aureus, the MICA gene encodes penicillin-binding protein 2A, PBP2A, with a dissociation constant, K_D, for beta-lactams that is 10-fold higher than native PBPs, resulting in mic elevations greater than or equal to 4G/ml for oxacillin, CLSI 2023. In enterobacterals, extended-spectrum beta-lactamases, ESBLs, such as CTXM15 hydrolyze cefotaxime with a catalytic efficiency, K_cat/K_m, of 1.2 times 10 m superscript 1 s superscript 1, shifting disc diffusion zones less than or equal to 15 mm for cefotaxime discs, 30 G, to the resistant category. Genetic regulation of efflux pumps, e.g., acrabitol C in E. coli, can increase ciprofloxacin mics by up to 8-fold, correlating with a 3 mm reduction in zone diameter per CLSI breakpoint tables. Signal transduction pathways such as the VAN-RS two-component system in Enterococcus faecalis upregulate VANA-operon expression, raising vancomycin mics from 1 G/ml, susceptible, to greater than or equal to 32 G/ml, resistant, within 24 H of exposure to subinhibitory concentrations. Clinical presentation. While AST methods are laboratory-centric, their clinical relevance is anchored in the presentation of infections they guide. In community-acquired pneumonia, CAP, the classic triad of cough, fever, and dyspnea occurs in 78% of patients. However, 22% present atypically with confusion or hypoxia, especially in those greater than 80 years. For bloodstream infections, fever greater than or equal to 38.3 degrees Celsius is present in 84% of cases, chills in 61%, and hypotension, SBP less than 90 mm of mercury, in 27%, IDSA 2022 BSI guideline. Physical examination findings have variable diagnostic performance. A murmur in infective endocarditis yields a sensitivity of 44% but specificity of 92%, AHA/ACC 2023. In diabetic foot infections, the presence of a penetrating ulcer predicts osteomyelitis with a positive predictive value of 71%, IDSA 2023. Red flag signs demanding immediate action include septic shock, lactate greater than or equal to 4 millimoles per liter, meningismus in bacteremia, risk of meningitis equals 15%, and rapidly progressive necrotizing soft tissue infection, mortality equals 3040% without surgical debridement. Diagnosis. 1. Specimen collection. Obtain sterile site specimens, e.g., blood, CSF, using a septic technique. For blood cultures, draw 2 sets from separate venipuncture sites, each containing an aerobic and an anaerobic bottle. IDSA 2023. 2. Initial gram stain. Perform within 30 minutes of receipt. A gram-positive cocci in clusters suggests Staphylococcus spp, prompting empiric vancomycin 15 mg per kilogram 4Q12H3. Culture and isolation. Incubate plates at 35 plus or minus 2 degrees Celsius in 5% CO2 for 1824H, subculture to obtain pure colonies. 4. Inoculum standardization. Adjust a suspension to a 0.5 McFarland turbidity, is almost equal to 1.5 times 10 CFU/ml. Verify with a nephelometer, plus or minus 0.1 McFarland tolerance. 5. Disc diffusion. Plate 100 L of standardized inoculum onto Mueller-Hinton agar. Apply antibiotic discs, e.g., ceftriaxone 30G, ciprofloxacin 5G. Incubate 1618H. Measure zone diameters to the nearest millimeter. 6 is interpretation. Compare measured zones to CLSI 2023 breakpoint tables. Example: a ceftriaxone zone of 22 mm is interpreted as susceptible, greater than or equal to 23 mm is resistant. 7. Broth microdilution. Prepare twofold serial dilutions of each antibiotic in cation-adjusted Mueller-Hinton broth ranging from 0.0625 to 64 g/ml. Inoculate each well with 5 times 10 CFU/ml. Incubate 1820H. The lowest concentration with no visible growth is the Mic 8. Quality control. Include ATCC reference strains, e.g., E. coli ATCC 25922, with expected zone diameters of 3035 mm for ceftriaxone and mics of 0.25 g/ml. Deviations greater than plus or minus 1 mm or plus or minus 1 dilution trigger repeat testing. When deep tissue infection is suspected, percutaneous needle biopsy is indicated if imaging shows a collection greater than 2 cm, the patient has fever greater than 38 degrees Celsius, and CRP greater than 100 mg per liter, sensitivity equals 85%. Specimens must be transported in anaerobic transport media and processed within key points. Complete blood count, CBC WBC 410 times 10/L is normal. Leukocytosis 12 times 10/L has a sensitivity of 68% for bacteremia. Serum lactate, greater than or equal to 2 millimoles per liter indicates tissue H. References. 1. Tama P.D. et al. Successful treatment of carbapenem-resistant Acinetobacter baumannii meningitis with sulbactam-durlobactam. Clinical Infectious Diseases, an official publication of the Infectious Diseases Society of America. 2024, 79, 4819-825. PMID 386308990, https://pubmed.ncbi.nlm.nih.gov/386308990. DOI 10.1093/SID/SCIE210. 2. Wenzler et al. Antimicrobial susceptibility testing, an updated primer for clinicians in the era of antimicrobial resistance. Insights from the Society of Infectious Diseases Pharmacists. Pharmacotherapy. 2023, 43, 4264-278. PMID 368254880, https://pubmed.ncbi.nlm.nih.gov/368254880. DOI 10.1002/FAR2781. 3. Yang Y et al. Comparison of disc diffusion, mic test strip and broth microdilution methods for eravacycline susceptibility testing. Clinical Microbiology and Infection, the official publication of the European Society of Clinical Microbiology and Infectious Diseases. 2025, 31, 7/12/31-1233. PMID 40254058, https://pubmed.ncbi.nlm.nih.gov/40254058. DOI 10.1016/J.CMI.2025.04.014. 4. Baltazar et al. Comparative evaluation of disc diffusion and broth microdilution methods for As-Trianam/Avibactam susceptibility testing in Enterobacterals. The Journal of Antimicrobial Chemotherapy. 2025, 80, 123273-3277. PMID 41001706. https://pubmed.ncbi.nlm nih.gov/41001706. DOI 10.1093/JAC/CAF361. 5. Hong X et al. Evaluation of sulbactam-durlobactam disc diffusion and broth microdilution methods for Acinetobacter baumannii. International Journal of Antimicrobial Agents. 2026, 67, 11076559. PMID 41176189. https://pubmed.ncbi.nlm.nih.gov/41176189. DOI 10.1016/j.igentimicag.2025.107659. 6. Palladini G. et al. Comparison between broth microdilution and agar disc diffusion methods for antimicrobial susceptibility testing of bovine mastitis pathogens. Journal of Microbiological Methods. 2023, 212:106796. PMID 37544431. https://pubmed.ncbi.nlm.nih.gov/37544431. DOI 10.1016/j.mimit.2023.106796. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.